Hello, and thank you for contacting Wave Support. I see from your case you have a patient who's had Intacs implanted in this left eye and has a history of corneal ulcers. From my understanding is that you're concerned about the way the lens fits, that it's dropping a little bit, and you're concerned about sealing off. Well, let's take a look a little bit at this topography. As you know, with Intacs, you get this steep ring out here, and it tends to be quite peripherally, which doesn't leave you a whole lot of landing area here in the peripheral cornea. So one thing to keep in mind, I try to keep these lenses as big as possible. In some cases going into semi-scleral design if we have to, but I know you have some concerns about potential for corneal ulcers. Another thing to look at is your two principal meridians are the 30-degree steeper meridian and the 120 flatter meridian. As you know, this lens will have a tendency to want to rock over that flatter meridian, have a tendency to drop down here into the lower part of the cornea. For that reason, when I first start initially designing these lenses, I try to make sure I choose not to average the corneal astigmatism. Sometimes averaging it out tends to hide some subtleties in this astigmatism. So that's one of those little subtleties I like to keep in mind. Well, let's look at your designs. I actually like the design that you came up with here. It looks like it's pretty well lined all around, and I see why you chose the points that you did as far as the red and the blue dots here. One thing I might recommend, because this area seems like it's dropping in the bottom part of the cornea, you have this large area of steepening here. I might recommend trying to get that mid-peripheral curve to somehow line a little more closely to that area. So what I might recommend is going to a little bit smaller back surface OZ, maybe down to about a 6.2 or so, and then keeping this intermediate zone a couple millimeters in size. I'll show you a mock-up here of that in just a moment. Another trick that I've used sometimes, and some of these patients where I can't quite get them aligned, sometimes I'll switch from axial to tangential design. If you recall, axial tends to align very nicely with the central cornea, but sometimes it's a little bit steeper of a lens. And while we generally think of steeper lenses centering better, sometimes we can use the tangential design to get them to line up better. And what I mean by that, if you recall, tangential lenses tend to represent the peripheral part of that topography a little bit more accurately than axial. So sometimes you can get that tangential to more closely match this peripheral cornea a little more appropriately. You'll get that lens to center a little bit more nicely. You may also recall that tangential designs tend to fit maybe a quarter or a half diopter flatter, and so in most cases that'll help reduce the tendency towards sealing off on these lenses. So I did a quick mock-up here of a lens based on that concept. And if we look at this design, basically I went to a 6.2, and I tried to align this mid-peripheral curve more closely with this very steep area, and I went to tangential design to try to align, to use more of that peripheral cornea in the actual design of the lens. Another thing to keep in mind is the central thickness. Even though we always worry about flexure on these lenses, sometimes, as you recall, if you reduce that central thickness as thin as you can get it, that'll move that center of gravity a little bit more and hopefully keep it from being so central heavy. That may help it lift up a little bit more. You can also sometimes consider trying to go to that, trying to create a little bit of a lip here in the superior quadrant, kind of by going to your 50% and trying to lift that top part a little bit more to see if you can create almost like a little edge for that lid to grab. At any rate, I would start first by trying to better align this peripheral part of the cornea, keeping it large as you can, and that'll help reduce the tendency towards seal off. Well, I wish you well with this case. These are challenging cases. As you know, the rules kind of go out the window, but I think you're on your way to a successful lens. Have a great day, and thank you for contacting Wave Support.